Welcome to the Observe Day podcast, the show where we celebrate the days that matter. From holidays to meaningful observances, we bring you inspiring conversations, stories, and ideas to make each day count. Whether it's raising awareness, learning something new, or simply sparking joy, this is your space to explore the calendar in a whole new way. I'm your host, Wisdom Okonkwo, and I'm excited to share today's observance with you. Let's dive in. Today on Observe Day, in celebration of Men's Health Awareness Month and the global Movember movement, we're diving into the critical conversations around men's physical and mental health. Our guest, Sam Peterson, is the founder and CEO of MindSpa Denver and a combat veteran who has dedicated his life to revolutionizing mental health care. After his own battle with PTSD, Sam co-founded MindSpa and the Patriot Power Up program, creating cutting-edge treatments that combine ketamine therapy, transcranial magnetic stimulation (TMS), and hyperbaric oxygen therapy. These therapies aren't just managing symptoms, they're helping veterans and first responders rewire their brains, recover from trauma, and reclaim their lives. Sam is also the founder of the Invictus Project and a non-profit that provides access to these therapies for those who need them most. His journey from army bomb technician to pioneering mental health advocate is nothing short of inspiring, and today we'll explore how innovation, community, and awareness are changing the landscape of men's health. Welcome to the podcast, Sam.
Thanks for having me.
Yeah. When you hear men's health awareness, what comes to mind for you, especially from your personal journey?
Well, when we talk about men's health, I think it's important to acknowledge the struggle that a lot of young men, especially in the United States, are going through right now, where we have a vacuum of what I would call positive masculinity. So often being a man gets conflated with the negative aspects of masculinity, whether it's being brutish or misogynistic or too hyper aggressive. There's a big problem in today's society with what positive masculinity really means, and that plays into the mental health struggles of young men significantly.
Yeah. Well, once the word men's mental health, why do you think conversations about it carry stigma? Because most times people don't want to talk about it for some reason.
I mean, I think that the reason that people don't want to talk about mental health issues is because the traditional treatment programs that, especially here in the States, have been um, ingrained in us, the use of just talk therapy and medications, they don't really get to the core issue of mental health disorders like depression, anxiety, and post-traumatic
Yeah.
stress disorder. They simply mask symptoms, and that leads to a significant stigma, because if I go to the doctor with the impression that I'm not going to get better, society has told me, and our popular culture has told me that I'm not going to get better, then I'm admitting that I have this scarlet letter on my forehead of
Yeah.
depression, anxiety, or PTSD. And the stigma comes from the fear that that scarlet letter will never go away and I'll be stuck with this label.
Yeah. I mean, you've lived through PTSD and trauma yourself before creating MindSpa. Could you share a bit about that journey? And I'm also curious, what made you decide to dedicate your life to mental health innovation?
Yeah, I mean, the biggest hurdle that I had to get over was just dealing with loss. Dealing with the loss of family members, with identity, and with some of the trauma that came from being a combat vet. But I'll tell you, the one thing that almost put me in the ground was that while I was deployed my second time, I got the Dear John letter while I was deployed, saying that my fiance had run off with an insurance salesman. And I'll tell
Mm.
you, nothing will put you in the ground faster than betrayal and failed relationships.
Yeah.
So that was what I really struggled with. And then the reason I got into using more effective treatments for PTSD, traumatic brain injuries, depression, and anxiety, was because I was watching my bomb tech brothers and sisters drop like flies to suicide because they were under this same stigmatic approach to mental health where they thought, hey, I've got a traumatic brain injury, I'll never get better. I'm in pain every single day. And so the only way out of this pain is to go swallow a bullet.
Yeah. Now you said the reason why you decided to get into this is because looking around you saw your colleagues and people in the bomb departments giving into suicide and all that. I'm curious, what was the approach like? Was it more like I'm going to help um deal with this issue on ground, and you're like, okay, let me go into this, let me study this, let me find out how I can help? Or was it more like, oh, you just realized that, well, the traditional is not working, I should come up with something different? Or were you already looking for a solution and trying to see what the traditional was, and then you realized that the traditional was not working? I'm curious what the approach was for you.
No, I mean it all started right after my near suicide. Like I had my gun in my mouth ready to pull the trigger, and the only reason I didn't is because my phone went off in my pocket. And it was one of my best friends invited me over to his place, and I was introduced to MDMA for the first time. And that experience completely changed my life.
Yeah, for
I grew up in a pretty troubled home, and
I'm
I got to
curious,
feel joy for the first
what's
time.
MDMA? You just
Uh,
mentioned something.
MDMA is commonly referred to like the street drug ecstasy. Um, it is an entheogen that causes all that feel good serotonin that's stored in your brain to get dumped into your brain cells, and gives you this profound feeling of joy and well being, and also releases a chemical called oxytocin,
Okay.
which is a big part of mammalian bonding. MDMA is is a drug that's been made illegal for many many years by most governments, including the government here in the United States, and you know wrongfully so. Um, it's very rare that you can find a substance that has so much therapeutic benefit with so little potential downside, especially when it's done responsibly and in a clinical environment. But that experience changed my life, and it opened me up to the fact that I may not have to feel this way all the time. And what really set me down this path was about 5 months after that experience. I was, getting ready to get out of the army. I was excited about life for the first time, really starting to find myself and enjoy my experiences literally for the first time. And one of my mentors, it was Memorial Day, so you know end of May. I was the last guy to talk to him at the unit, and he walked out in his backyard and shot himself in the head with his 3-year-old son in the house,
Ooh,
and it made me really really angry, because I know that if Neil had had the experience that I had had 5 months earlier, he'd still be alive. And so this was built out of anger and disgust for the system as it existed back then.
yeah. When we're having a conversation about brain injuries, PTSD, a lot of persons they come to understand these terms and these things to be something permanent, and so they're like, quote unquote, the damage is done. Why is that belief wrong?
Yeah, so the damage is not done. With post-traumatic stress disorder, if you were to like do a cutaway of the brain and really look at how it's functioning, what you would see is an underactive prefrontal cortex and an overactive amygdala. So your more primitive parts of your brain are hijacking your lived experiences all the time and forcing you into courses of action where you really don't have the brakes on, where you're not in control. We have therapies here that can address that phenomenon. Transcranial magnetic stimulation is one. We're using an MRI coil uh, to create a magnetic field inside your brain tissue, and we can use that magnetic field to increase the density of neurons in a specific area. And what that does is it functionally creates a louder megaphone for your executive functioning center to tell your limbic brain to shut the hell up. Um, And nobody discusses that. Nobody discusses the effects of neuroplasticity on healing PTSD. You know, we're just starting to get into the psychedelic movement again in psychiatry, where we can utilize some of these incredible tools to help people heal faster, because these are not life sentences. PTSD and traumatic brain injuries can absolutely be healed. There are mountains of clinical research on the use of alternative therapies to treat these issues in the brain.
Yeah. Oh, at the beginning of the episode, I was introducing a lot of the concepts. Like, I was like, oh, ketamine treatment, TMS, HBOT,
Yeah.
and for a lot of persons, including me, those are completely new words and new concepts. Can you, in
Yeah.
simple terms, actually explain how therapies like these actually help rewire the brain, in layman terms, so we understand?
Yeah. Yeah, easily. So first we got to take a step back and realize, what's going on in the brain. So in the instance of depression, anxiety, or PTSD, and I'm speaking in very broad terms here,
Yeah.
um, when those conditions are present in the brain, there's your executive functioning center is underactive and your hindbrain is overactive. So just like that example of PTSD, the amygdala is getting revved up and it is hijacking your experience. Imagine that you're living in a 2-story house, right? This 2-story house represents your brain. You're living on the top floor and your limbic brain is on the bottom floor. And when these conditions are present, your limbic brain.
Before we dive deeper, I'd love to invite you to join the Observe Day newsletter. Every week, I send you highlights of upcoming observances, creative ways to celebrate, and behind the scenes extras from the shows. It's the perfect way to stay inspired and never miss a meaningful moment. Sign up today at observeday.com/join. That is observeday.com/join. Now, let's get back to the conversation.
Brings in a big speaker system and it
Yeah.
starts blasting really loud music. And you're up here on the top floor trying to stomp on the floor to get your downstairs neighbors to shut the hell up, and they can't hear you because the music's too loud. So what these therapies do is we're giving your prefrontal cortex, your executive functioning center, a louder megaphone so it can tell your limbic brain to shut the hell up. We do this in a couple different ways. The first thing to understand about all of these conditions is that they're highly, highly inflammatory to the brain. So they're causing a lot of inflammation. That's a big deal because the blood vessels in your brain, especially in the prefrontal cortex, are really, really small. They're so small that in certain places, a single red blood cell can pass through at a time. So it doesn't take a whole lot of inflammation before your brain is starved of oxygen. And that causes an inflammatory cascade that continues and gets worse and worse and worse over time. And that's what leads to these treatment resistant conditions. Until you address the inflammation in the brain with these chronic conditions, you stand a very slim chance of being able to help the patient.
Oh, oh. The approach you use for solving these and for treating these things, it's novel. It's a bit different from the traditional. And so I'm curious, what are some of the results you've been seeing from combining these treatments, um, and how do they compare to the more traditional methods like talk therapy, medication, and all that?
Yeah. So let's start with the results from, let's just take depression, for instance. The largest study ever done on antidepressants is called the STAR-D study. It showed that on their very best day, an antidepressant medication has a 33% chance of doing anything but giving you side effects. So 33% chance of causing a positive change. Typically, antidepressants are given over a course of 8 to 10 weeks. So in order to figure out if this drug even works, we got to wait 8 to 10 weeks.
Oh, that's a long time.
So yeah, that's a long time. That's a long time to be in the suck.
Yeah.
So yeah. So first go around, there's a 33% chance this thing will help you at all. When we get to the second round, 8 to 10 weeks later, there's about 26 to 24% chance that it's going to do anything but give you side effects. By the time we get to the third the third medication, that efficacy number drops to 16%. And by the time we're at number 4, we're at 6%. A 6% chance this thing will do anything but give you side effects. And these drugs don't even have a remission rate. They have a response rate. So they're saying that there's a chance that this thing can drop your symptoms up to 50%. And that's the best it'll probably do. The treatments that we use have not only response rates, but remission rates. And remission rates, I'm defining remission rates as at least a 75% reduction to a complete reduction of symptoms. So if you take transcranial magnetic stimulation, for instance, about 75% of patients respond to their first course of TMS. So and then that's done over 6 weeks. So instead of waiting 8 to 10 weeks to maybe, stand a third of a chance to get a result, you're getting a 75% chance right up front in the first 6 weeks. Of those 75% who respond, 50% of those go into full symptom remission. And that's just from one therapy. When we stack these therapies, what we're seeing in our patients is the average time to reach symptom remission is 14 to 17 days.
Oh, that's 2 weeks.
Yeah. Yeah, 2 weeks would, 2 weeks. And we're also seeing significant increases in executive function, in memory, in sleep hygiene, and as well as having all of these symptoms almost completely reduced within that time frame.
Yeah. Out of curiosity.
So it's a no-brainer.
Why does nobody talk about this? Like these concepts, all the things you just introduced me to, they're completely new to me. Like they're completely different from what I know. Like even though all this facts and all this stats, yet no one is talking about it. And even though I'm interviewing you, I wouldn't have even known all these things. Why? Why is that the case?
It takes a while for treatments like this to get into the consciousness of the general population. I mean, TMS has been around since the 80s. It's been approved for the treatment of depression since 2008. It takes time for medicine to catch up, because this is totally my opinion, but I see this a lot in psychiatry. So much of the medical establishment and medical training teaches physicians to be afraid of new things. It teaches them to follow the standard of care, follow the formulary, and don't stray outside of it. Because if you do, you open yourself up to all kinds of litigation. People can sue you because you didn't follow the standard of practice. You decided to color outside the lines. And we have an entire system that is incredibly litigious here in the US. And that is a big, big part of the problem.
Yeah. That makes sense. Yeah. Oh, and
nobody wants to get sued.
It's new. It's not traditional. And there's a reason why it's not traditional, because it's not been adopted to become the new norm. Hopefully it does. Why you were sharing?
That's what we're working on every day.
While you were sharing your story, there's one thing you mentioned. You mentioned that you were at a point where you were about to put a bullet in your head, and you got a call from a friend of yours, right? And I want us to talk about the importance of community support. By community support, I'm talking about friends, families, for men's mental health, especially for veterans and first responders.
Yeah, I mean, community is everything. We're mammals. I'm gonna take. This really plays into mental health in huge ways, especially if we're talking about things like substance abuse. So there's a wonderful book called Chasing the Scream by Johann Hari. And in the book, he talks about the mammalian model of addiction. And this plays very much into community. I'll get there in a second. Okay. So what happens is, he talks about the rat park experiment. So they were studying chemical hooks. We're told all our lives that if you start doing drugs, you do things like cocaine or heroin, they have chemical hooks, and you do them one time and you're hooked until it kills you. So they ran this experiment. They took a rat, they stuck it in a cage that had food, water, and heroin. What happened? Rat did heroin until it died. Oh God, there's chemical hooks here. These drugs will kill you. If you try them once, you're stuck. But then they took that same rat, and they put it into a much larger cage that had a bunch of other rats in it that had toys, they could run around, they could have sex, there was plenty of food, and they put those same things in there: food, water, heroin. Now, the theory of addiction as it stands would lead us to believe that all the rats would die. They would all become heroin addicts and die. That's not what happened. The rats would go up, they would try the heroin once, and they would never do it again. That's the power of community. That's the power of relationships, because it's not about the chemical hooks of a substance. It's about the community you have around you. It's not about these dangerous things that can steal your life. It's really about the cage that you're in. And that framework shows us how important community is, not just to humans, but to mammals in general. It is so very vital that we are having positive connections with humans, that if we don't, it causes serious mental health concerns and problems. Just look at what happened in COVID. Depression in the US spiked dramatically. It spiked all over the world because we weren't able to connect.
Yeah. Well, at the beginning, I mentioned that men's health, especially men's mental health, has conversations about it have a certain stigma. People don't like to talk about it. And from your perspective, what are some of the biggest barrier men face in seeking mental health care? And how can families, friends, workplaces break those barriers?
Well, I think it all comes down to where you're getting your dopamine from. It's so easy in today's day and age to get stuck behind a screen, to get addicted to pornography and video games, and use that as your primary method of connecting with the world and connecting with yourself. Um, it really comes down to, I think, getting out and doing activities with people, doing something physical, doing something that requires you to sweat a little bit. If you can do that regularly, we see the data, and the data on mental health outcomes is much better for people who engage in sporting activities and have at least one communal hobby with their friends or their significant other. So it's vital that we do this, and we need to push our young men to not hide behind a screen, because it's very easy to do.
Yeah.
We have to create new norms. And so much of our society tells men that this kind of goes back to the masculinity conversation. It tells us that you're not supposed to put yourself out there. We're supposed to now be in this passive stance towards the world. And that's incredibly damaging, because testosterone dictates to us that we need to go out and kind of conquer the world a little bit. Go hunt, fish, run, and make ourselves useful. That is the mandate for men. And so much of our society has shifted towards this insular and non-masculine male being the archetype that we strive towards.
Yeah. Yeah. Well, thank you so much, Sam. Um, you're working in the new uh, the solutions that are that they're not traditional. Looking ahead, what are some of the breakthroughs or changes in mental health treatments that you're super excited about?
Well, I'm super excited about, what we're doing here, this combination of ketamine infusion therapy, hyperbaric oxygen therapy, and transcranial magnetic stimulation, along with culturally competent talk therapy. I'm really excited for this protocol to take center stage and to really start changing the zeitgeist about how we view mental health disorders as a whole. I'm also incredibly excited about the clinical applications of psychedelic therapies. There's so much we have yet to learn about how psychedelics affect the brain and how they increase neuroplasticity, how things like ibogaine can be used to treat traumatic brain injuries. This is incredibly exciting. This is probably the best time in history to be in psychiatry, and I find that incredibly exciting.
Yeah. Well, thanks for sharing those developments with us. If you could leave men listening with one takeaway this men's health awareness month, what would it be?
Yeah, if there are men out there that are struggling, my message to you is you don't have to feel this way. We have treatments that can help you get out of your shell, to feel better from your current situation and allow you the space so that you can go out and pursue more healthy habits. And that's what it comes down to as well. You can do all the mental health treatments you want in the world. And if you go back to that same situation, hiding behind a screen, you're going to end up in the same spot. It is our mandate to connect with people. So, this is a twofold message. One, you don't have to feel this way. We have treatments that can help you. And two, you have a mandate to get better, feel better, and go out and make a positive mark on the world. There are too few good, strong, positive males in our society today. And it's up to every single one of us to pick up our torch and go out in the world and do something positive.
Yeah. Thank you so much for that advice, Sam. Where can listeners learn more about the work you do and also connect with you?
Yeah, best place to learn more about what we do is mindspadenver.com. And the best place to find me is on LinkedIn, Sam J. Peterson. I come right up. It's got my headshot. And I'm pretty responsive on that platform. You can also find us on Facebook and Instagram at MindSpa Denver.
Oh, thank you so much, Sam. It's been an absolute delight chatting with you. And I would add the links mentioned in the description and the show notes so listeners can just click and go directly to the site. Thank you, Sam.
Thanks, man. Appreciate it.
Yeah. That's it for today's episode of the Observe Day podcast. Thank you for spending your time with us as we explore today's observance. If you enjoyed this episode, be sure to subscribe wherever you listen to podcasts and share it with a friend who'd love to celebrate life's special days too. Don't forget to join the newsletter at observeday.com/join for more observance stories, tips, and updates. Until next time, keep finding meaning in every day.